Thank you for joining us today. My name is Kyle Cameron. I work with the Medicare Rural Hospital Flexibility Program, and with me today is Lillian Zuniga, the Program Manager for the Office of Health Equity.
Welcome.
We work with the Office of Rural Health, Rural and Frontier Health Unit with the Wyoming Department of Health. Go ahead. Thank you for that. Good. Next slide. Our objectives today are to increase your awareness of implicit bias, learn how implicit bias affects everyday life, and learn some tips on combating hidden bias. We want to start by just talking about a safe space. A safe space is anywhere you feel free from harm. I want to repeat that because it's very important for this kind of discussion to have a safe space where you feel free from harm. So we want to make sure that when you are creating a space for talking about implicit bias, that the space is safe for everyone to speak freely without fear of retribution or harm. Go ahead, next slide. Over there. Implicit bias refers to unconscious stereotypes toward a group of people that affect our understanding, actions, and decisions. Implicit biases can be positive or negative, and they affect us without our awareness or control. A person can unknowingly prefer one racial group over another without being vocally and consciously racist individual. For example, a white man who does not consider himself to be racist or sexist may unconsciously consider other white men while conducting job interviews compared to Black people or to women. He does not intentionally have a higher opinion of the white men he interviews, but implicit bias can play a role in his consideration. Such implicit biases can have seriously negative consequences in the advancement of racial, religious, and sexual minorities. The next thing we're going to look at is a word association test. This is that game that we've all played where one person says a word and the next person says the first thing that comes into their mind. This is similar, except you will write down, without hesitation, the word good or bad after each word is presented. Sir Francis Galton was the first scientist to introduce word association tests into the study of psychology. The test is administered like this. A word is presented, and you write down the first word that comes into your mind. For this test today, you will write down either the word good or bad, depending on the first thought that crosses your mind. Do not judge your word or thought. Simply write good or bad. There will come a time for sharing, but you do not have to share if you do not want to. If you have any questions, then I suggest that you go ahead and pause your presentation now and talk about some of the things that you might have concerns about. Remember, this is a simple test, so when you begin it, you're just going to write down the word good or bad as quickly as possible. And do not pause the presentation until it is completed. If you're ready, let's go ahead and get started. Rose. Dragonfly. Cow. Dog. Iris. Gnat. Sheep. Cat. This test is complete. All we want you to do at this moment is notice. Notice what you wrote. Notice what you are feeling. Implicit bias can cause harm, sometimes unintentionally and sometimes intentionally. Here are some examples of microaggressions that people experience every day because of implicit bias. My hair is real. I can actually see you. Muslims are not all terrorists. I will not cut your grass. I am not a color. I'll marry whoever I want. I am not white trash. Not all Asians are studious, have squinty eyes, and speak the same language. And we're not all Mexicans.
So in healthcare, bias comes in various forms. And I would say there's three primary ways that we could actually track bias. One, of course, is in interpersonal interactions, let's say between a patient and a provider. So the unconscious ways that we may have associate certain groups, certain gender identity, people with certain gender identities, people from certain racial or ethnic backgrounds, manifests in the diagnoses we're making, the interactions we're making with the patients, as well as the warmth with which we're working with them, which impacts the amount of trust that they have in the providers themselves. How does that manifest? One of the major ways that's been studied and shown and reported over and over again is pain management. So patients with darker skin, African Americans, receive lower dosages of pain medication across the board, from infants to the elderly, for the same types of ailments they come to practitioners for, because of assumptions that are being made around addiction or their ability to actually be truthful around what they're experiencing. The second way bias really plays into all of this, particularly unconscious bias, is the internal dynamics of organizations, how employees and staff members communicate with one another, team collaboration, team dynamics, but as well as performance reviews, reviews around compensation, who gets to be promoted, who gets to be a leader of an organization, of a team, based on assumptions that we may have about those people, purely based on phenotype, their origins, whatever that may be. And the third way bias really plays out in healthcare, and this is quite well documented across the board, is its costs, wasted costs. So racial bias, just one particular identity that we're concentrating on, costs the U.S. economy, the healthcare system, $310 billion a year. And for me, I just want to think about what can we do with that money if we didn't have bias in the world.
So now we have some discussion questions. And again, you're more than welcome to pause and answer some of these questions within your small group. People of color receive lower doses of pain medication because of implicit bias. Can you think of other examples of different groups being treated differently in the healthcare system? Has someone ever made an assumption about you based on how you look? Was it correct or incorrect? And how did that make you feel? And Group D mentions the high cost of implicit bias in healthcare. Do you think the cost is the most important reason to address this problem? Why or why not? Research shows that the best way to remedy the effects of our implicit bias is to immerse ourselves in opportunities to make positive connections with a diverse group of people and experience situations that may put us outside our comfort zone. In this way, we can all begin to chip away at our personal ingrained implicit bias. Ultimately, both institutional and individual solutions can help us provide more accountability to ensure that as a community, we are providing the best healthcare possible. This particular implicit bias test is put on by Harvard University, and you can click on the link and you should be able to access the test. It is an interesting test, and it should only take you a few minutes to go through and work through. Unconscious bias and health disparities. Where do we go from here? This is an article by Blair, Steiner, and Habernick in 2011. For clinicians, consider your gut reactions to specific individuals or groups as potential indicators of implicit bias, and consider how these reactions might affect your work. Acknowledge and reappraise rather than suppress uncomfortable feelings and thoughts. Consider the situation from the patient's perspective, and consider changing situations that increase negative or stereotypical responses. And partner with researchers and participate in research to advance understanding of implicit bias and to develop evidence-based interventions. If you're a policymaker, affirm equity of care and diversity as core organizational and institutional values. Consider ways to improve detection of disparities and reconsider policies that may unintentionally worsen disparities. Support research that seeks to better understand bias and develop interventions to improve communications and lessen disparities. Support clinicians' efforts to implement change to address disparities directly. Invite dialogue with the community to better identify services in need of improvement and unrecognized biases in the healthcare system and workforce. And support efforts to increase workforce diversity, especially in administrative and management positions. And if you're a patient or a community member, consider implicit biases that you yourself may bring into the healthcare setting. What are your gut reactions and how might they affect your thoughts and behaviors? Partner with researchers and participate in research to better understand bias and develop interventions that are effective and responsive to the needs of the community. Realize that your clinicians are people too. To the degree that bias exists in healthcare, it is not unique to that arena and must be addressed as a community. Patience and honest communication can help solve many problems. Provide feedback to your clinicians to improve services, especially in areas that appear to be inequitable. And this is just for fun.
Clearly, somebody in this room murdered Lord Smythe, who, at precisely 3:34 this afternoon, was brutally bludgeoned to death with a blunt instrument. I want each of you to tell me your whereabouts at precisely the time that this dastardly deed took place.
I was polishing the brass in the master bedroom.
I was buttering his lordship's scones below stairs, sir.
Why, I was planting my petunias in the potting shed.
Constable, arrest Lady Smythe.
But how did you know?
Madam, as any horticulturist will tell you, one does not plant petunias until May is out. Take her away.
That's right, madam.
It's just a matter of observation. The real question is, how observant were you?
And action.
Clearly, somebody in this room murdered Lord Smythe, who, at precisely 3:34 this afternoon, was brutally bludgeoned to death with a blunt instrument. I want each of you to tell me your whereabouts at precisely the time that this dastardly deed took place.
I was polishing the brass in the master bedroom.
I was buttering his lordship's scones below stairs, sir.
Why, I was planting my petunias in the potting shed.
Constable, arrest Lady Smythe.
So we want to thank you for joining us today. We will continue to have these cultural competency tidbits, and we look forward to your feedback and any information that you want to share, any insights that you have. Thank you.
Thank you.